HornbillTV itia niatu resort chumukidi mate aigna se ekta bal kobor Idan Toyota Killers Car CSR Corporate Social Responsibility laga initiative loigina Choita District nimite medical equipments ambulance aro school duita nimite itu school furnitures materials aro sports equipments can be donate kurigina aji itu assets kan tu handing over takibole laga se moan jani paise itu CSR laga initiative te materials kan dia laga upor tu hele tu more than 10 crore laga itu ekta project ase koigina moan jani paise aji chief minister Dr. Nifurio deputy chief minister bi aigina itu Toyota Kilos car kan la logo miligina itu equipments aro itu ambulance charta bi itu Choita district ke dibule laga se moan jani paise itu medical equipments tu hele tu 11 health sector Pansta PHC primary health center charta community health center aro duita district hospital ke itu medical equipments kandu dibulela ase koina mon jani paise ibi itula details program be mon sailobo.
While giving my appreciation and my compliments to our partners, our collaborator of Toyota Kilosker Motors, I also give my appreciations to Idan, led by Chairman Abu Mehta, for networking and collaborating, partnering with the state and bring these CSR programs to our people. I think the good works they're doing in our state is not only today, but several times, as already had shown in the slides, how Vikram had explained. For the last many years, they have been working with us, helping in all sectors and creating an impact, particularly to our youth, to TAFMA, to sports and games, and also I could see myself during Hornbills, you used to not only exhibit your cars in Kisama, but you give your best luxuries vehicles for our guests, which is very highly appreciated. It gives a good impression to our guests also, and I think it's a nice way of showing and exhibiting your kindness to our people. For the state of government, these two departments, health and education, is our top priority department because the citizens has to be healthy and any student or any born baby has to be educated, has to be literate, and that's how we progress. I had a study. So when the statehood was born, 63 years ago, in 1963, the literacy rate was only 22%. But because of the commitment and support from different projects, our state now stands at 96% literacy rate, which is one of the highest in the country also. And not only literacy, but quality education being imparted. But those are, facilities are available, quality educations are in the towns and cities where it is near to reach. We have interior places yet to reach those facilities and also quality education. So as mentioned earlier, I think if this kind of CSR continues to reach particularly to the ENPO area, the backward, the last mile of the state, it will be highly appreciated. And your commitment, we really appreciate. We'll continue to look upon you, to have collaborations and friendship. And I hope our youth will take a full advantage of this. And also today the assets handing over to the departments, I hope you'll make good use of it. And these materials, why even the school see up to utensils? We want this to be a benchmark. Insisting on quality control. You heard about children in Japan, in schools. The schools, the teachers, they are like friends. They come to school and they maintain cleanliness in their homes, also in their working place and in the schools. They all take off their shoes and go inside the schools. Then they eat the same food, teachers, students, and after the school is over, they will work together again to clean all the utensils, plates, cups, kitchens, kitchens, and then school itself. Then everything is over, then they will take a holiday together and come back to the routine. So this kind of, habits. And why they are going to the smallest detail is, I think we have to learn from them. For us, like Kohima, Dimapur, or headquarters, our people have maintained cleanliness. But in the rural villages, you live in one room, the whole family, the kitchen, the bed, the stores, the utensils, your extra goods are all in one room, and you function. And even your veranda, your animals lives with you. So those periods are over. Now we have to learn.
Idan has played the role it was created for building partnership that deliver real outcomes on the ground. This initiative is special because it is planned with clarity and executed with discipline. The project focuses on 6 districts: Kohima, Dimapur, Newland, Chimikitima, Teminiu, and Zinubudo. And it strengthens essential healthcare infrastructure while improving educational facilities in selected institutions. Under the healthcare component, the project has been provided advanced life support and ambulance to 4 healthcare centers and critical medical and non-medical equipment across 11 health institutions. Alongside this, the education component has supported, as mentioned by our Idan chairman, 2 selected government schools as a pilot project with furniture, sports, equipment, and kitchen items to improve the learning environment. The assets being handed over are public assets. They are not for display or for occasional use, but are for daily service. I urge all beneficiaries, departments, and institutions to ensure efficient and judicious use of every asset. These must be maintained properly, deployed wisely, and kept functional. This partnership also shows the strength of collaboration. Toyota Idan and the concerned line department work together with coordination from start to finish. Nagaland still has many districts and many institutions that require support. There are areas that remain uncovered, and there are remote places where access to healthcare and education infrastructures continues to be a challenge. While we celebrate what has been achieved today, we must also look forward. We look forward to more such collaboration in the near future. We look forward to scaling up this effort. We look forward to expanding coverage to all other districts as well, so that no region is left behind. Once again, I thank Toyota Kirloskar Motor Private Limited for this valuable support, Idan and its chairman, Sri Abu Mithaji, for their leadership and coordination, and all official officers and staffs from the Health and Family Welfare Department and the School Education Department who worked to make this initiative possible. Let today's handing over be the start of stronger services, better facilities, and better outcomes for our citizens.
Healthcare, as working towards with government cooperation to improve facilities, primarily around primary health centers and community health centers, where they really are needed, and of course, technical education and skilling initiative. Going forward, coming to Nagaland, and of course, once again, really thanking the government of Nagaland. I've not seen anywhere where we, within such a short period of time, we could actually do something that has resulted as output on the ground. And again, extremely grateful to the government of Nagaland for their proactiveness. Two big pillars, basically, where we've operated here: strengthening healthcare, which means supplying medical and non-medical equipments, and also ambulances to 11 health centers, which includes 5 primary health centers, 4 community health centers, and 2 district hospitals. We feel that this is really going to make an impact in terms of helping the communities, facilitating, working with the government in providing better healthcare. Enhancement in quality education, which revolves around supply of school furniture, sports material, and kitchen equipment, focusing around 2 schools to begin with. Then, of course, we have glimpses of the healthcare facilities that have been provided. We have estimated that this is going to benefit around 400,000 community members going forward. To the enhancement of quality education, the number of beneficiaries, this is the start of the entire thing. It will be around 500 students. This will help support student well-being, effective classroom engagement, and providing a holistic education experience to the children. To conclude, I'd just like to say that this is something we are proud of, our initiatives, not because it's about how much you spend, but it is how much you can partner. And the difference that comes out is through engagement and partnership. We've touched over 5.6 million lives so far, pan-India. But the kind of engagement and partnership that we've seen in Nagaland, it is unparalleled and second to none. I think it's way ahead. And again, I'd like to ask the audience to put your hands together to the government of Nagaland. It's an honor. Sir, believe me, we've not seen so much support, so much encouragement, so much motivation, your personal involvement.
Thank you very much. First of all, my thank you. I want to say a big thank you to Toyota Kirloskar Motors for supporting us in this CSR initiative, Corporate Social Responsibility Initiative of Toyota. Edu Chief Minister Sahab para Bangalore jaine tahan logot meeting kurise, moi tahan logot duibar timbar meeting kurise, aru December de Hornbill Festival time de moi khan business round table corporate khan logo partnership kuri kine discussion kuratum de MOU sign kuro parise. Today, within weeks of that MOU being signed, I'm happy to say that Nagaland is getting health equipment, health support and educational support from Toyota to the tune of more than 10 crores rupees, which will be distributed to 6 districts. This includes X-ray machines, health equipment, furniture and equipment for schools, and also critical life-saving ambulances for 4 districts, 4 ambulances. And I request our media friends also to give coverage to these ambulances, see the visuals and record what are the facilities that are included in this ambulance, because ambulances are supposed to give life support, they're supposed to give medical care at site, paramedical care, and these ambulances are fully equipped with that. So I'm very grateful to Toyota. As I said earlier, 6 districts will get these benefits. What we did with this scheme was that we used the Toyota team and the medical department to do a gap analysis. Kundu hospital de, kundu health center de, ki facility komti ase, ki lage, tate laga doctor, tate kana nurse khan logo kotha kurigine, ekta assessment kurigine, mohan itu pichide, itu saman dibo kurigine, mohan finalize kurise. Aro another thing is that mohan Idan department itu scheme do full transparency, full open, are in a very maintaining the best practices and higher standards. We have implemented this program. Kile mane ekta, not a single rupee was transferred to our account. We requested Toyota to use their own vendors, to do their own procurement, to do their own placement and implementation, so that we build trust, we build confidence, and we show that whatever CSR funds come to us, to our people, 100% is utilized on the ground. So that's the way we have managed it, and I'm hopeful that we are able to continue this program. We seek the support of Toyota and other corporate companies to also cover the whole state. Itu sal nohine itu ola scheme do. Our first intention was we wanted to cover the backward areas, the interior districts. Time thaganai. Kile mane itu within few weeks mohan target kurise, March ending la agede itu implement hobo lage, holibi in the next round of CSR activities, especially in healthcare, we will ensure that these facilities reach the backward regions.
Okay, sir, could you kindly amihal viewers kagi kuidiwo para the 6 districts kanto kung kana sir?
6 districts include Kohima district. The Kohima NHAK Naga Hospital Kohima needed a lot of critical care facilities, so that is included. Dimapur district, Chumukedima district, Newland, Chemenu, Zuneboto. I think these are the 6 districts that we've covered this time. Because as I said, there was time constraint, and itu kundu district de ki dibulaze, kundu hospital de, kundu healthcare ki dibulaze, Toyota team wanted to reach themselves and do the assessment. So that was why we rushed into this project, and we have to implement before March. Thank you.